Everybody, welcome to the Athletic Potential Podcast, episode 27. And we are excited to be here today. Appreciate everybody tuning in to listen. As a brief overview of every episode, we start every episode with a case and then we answer questions from our audience after that. And so one of the questions I actually received the other day was, how do you submit a question? And what we found is a lot of people don't know how to submit a question. Mainly because it's descriptions at the end of each episode. So let me just quickly say here, if you go to whatever you're listening your podcast on, whether that's on our webpage, whether that's on iTunes or Apple Podcasts, I should say, if you go there, there's a link on all of those that just says Ask Mike a Question, or click here to ask a question. You can also find it on the website, www.athletic-potential.com/podcast. There'll be a button there that says Ask Mike a Question. You'll then go ahead and just click on that button. It'll bring you up to a form that'll ask, input your question as well as some information, and that's how you ask your questions. So we definitely want to answer any questions that anybody has. So please submit your questions, and so let's get started. So the case that we're going to review today is an 18-year-old female softball pitcher who came to us complaining of right hip pain. Now, she is a right-hand thrower and pitcher, and she's been having hip pain or had hip pain for a substantial amount of time. And we are, I believe, the third clinician that she is now seeing. And when I say clinician, rehab specialist, I'll try to put that a little bit more specific. She's seen doctors, two doctors. She's seen two other physical therapists, and we are the third group that she is now seeing and asking for help. And what she has found in the past is that she'll get better, she'll return to pitching, and in about a month to 6 weeks in, her pain will return in her hip. And it's typically at the time when she's starting to really ramp up and increase the total volume of throwing and pitching that she is doing. And she's trying to hopefully avoid that this year, kind of a key year for her. She's going to college next year, and she does have some college interest right now, but we're hoping to help her increase the opportunities she may have to get a scholarship. And at this point, she's a little worried that her hip's going to become a problem again. And currently, we're in a bit of the off season of softball. If there is one, it seems like they're playing more and more these days. But the idea is this is the time where she'll be playing the least amount of competitive softball. And she had the insight and the foresight really to be like, okay, now's the time to really take care of this. And she showed up at our place, having been referred to us by one of her teammates. So she showed up, we did an initial exam, and what we found really quickly is that she had very asymmetrical hip range of motion. One side, her left side moved quite a bit differently than her right side, which isn't terribly uncommon in throwers. However, in her case, it was substantial. And we also had the benefit of having her seen multiple doctors, so two different doctors. She's had x-rays, which we were able to look at, and she's had an MRI of her hip. And the MRI was fairly inconclusive. It did show potential signs of what we call a cam deformity. It's a type of bone growth that happens on the hip that increases your chances of experiencing hip impingement. And upon her testing, we did a bunch of testing and looking at her hips, and like I said, we found asymmetrical range of motion. Her strength was actually quite good. She definitely tested fairly, I would like to say, weak for a softball pitcher in regards to her hip abductors. That's the muscles that pull the hips away. But everything else actually looks pretty good. She definitely could have better glute strength and glute activation, but nothing that was substantially really bad. And so, and that attests to the quality of work that was done with the physical therapist before, and they definitely addressed a lot of these things. And she came to us just saying, I really want to make sure that this doesn't come back this year, and I'm already feeling it right now after a fairly moderate load in the fall season. And so we kind of delved a little bit deeper. We took a little bit closer look at her MRIs. We took a little closer look at her x-rays. And what we've noticed right off the bat was it was a repetitive problem, which it typically is with impingement. But she had a repetitive problem, and it was a very specific part of the pitching delivery that she was having issues with. It's essentially when she propels herself forward when she has the most problems. And the pain is very specific in the front and middle inside, or sorry, groin area of her hip, and that's where most of her pain is. And when we tested her for impingement, and the test is quite simple, what you do is you essentially lay them on their back. You flex the hip up, put their knees close to his chest as you can, maybe not that far, and then you rotate the hip internally or kind of pull the heel out to the outside. And if they have pain in the spot where they're having pain during their activity, then we consider that a hip impingement positive sign. And she definitely had that. And then the interesting part was we put her in hip neutral and tested it again, and it was still positive, although not as painful. And I think the key finding in our examination, to kind of take a long exam, to be honest, her exam took an hour. We really had to go dive deep on details and really try to understand her problem. And it took about an hour, but to kind of summate what we found is that when we put her hip, her right hip, in neutral, but then flexed the left hip, basically took the left knee to her chest, and then we put the other leg out straight, and then we rotated it internally doing that same test. We just kind of torqued it on the inside. She didn't have any pain. Her pain was gone. But then the minute we put that hip back in neutral, so both legs are essentially out straight, she's laying flat on her back, and we rotated the hip internally, she again had pain. And this was a huge finding for us, because I think this led us down the road that basically what we found was she had a significant difficulty maintaining pelvic position during the pitching motion. And what happened was that put her pelvis in a position to cause hip impingement. Now, basically think of it this way. If you're standing upright and everything's in neutral, the hips should just be sitting in the sockets with tons of range of motion or tons of space all around the ball. In her case, when she would go to extend or step forward with her left hip, her pelvis would tilt. And what would happen is when it would tilt, the space on her right hip would decrease to the point where her bone started impacting bone, impinging. And in her case, it was predominantly when she really forcefully pushed it into that position. She would lose the ability to control or maintain her pelvic position. And that's when we noticed her pain was the most present. Now, the good news, the bad news about that is we didn't know how much damage was actually done. Her MRI was about 6 months old, and she'd had an increase in pain, and she had kind of talked about a slight increase in clicking in the hip, which isn't exactly the best thing we want to hear. We start worrying about labrum tears. A labrum tear is a piece of tissue that exists around the socket of the hip, and if you tear that, it can become quite painful to the point where it needs to be fixed or manipulated via surgery. And we're really trying to hoping to avoid that in her, mainly because again, she's got a senior year coming up, but we also needed to know if this was going to be what it was. And what we found was that if we could test her and get her completely out of pain in testing, I didn't feel confident in sending her to get a new MRI and to go then talk to a surgeon. And at this point, we decided against that because we could get her into positions and still produce internal rotation or rotate her hip inside and no pain. So we decided against a new MRI, and we decided against a consultation with a surgeon, although I was pretty much ready to go with that if we saw any signs of regression or no improvement. And what we did from that point on was we started from scratch. We really went after posture. I'll be honest, her hip range of motion was asymmetrical, but was not really out of the normal ranges that I'd expect to see in a softball pitcher. And so I decided not to go after range of motion. And we decided to do is go after pelvic and postural control. Now, she's a little bit taller. She's just under 6 feet tall. So I think she's like 5'10", 5'11". She has a fairly good posture for as tall as she is. But one of the things we notice is she stands in what we call sway back posturing. It's an archer of the lower back and then extra flexion of the upper back. And that was the first thing we fixed. And we went after that like crazy. We put her on this interesting regimen. I'll be honest, it's not for everybody, in the fact that it requires a tremendous amount of thought and a tremendous amount of concentration, and it is done all the time. So basically what I told her is, like, anytime you stand up, you reset your posture. And it's interesting how many times we sit and stand in a given day, because she counted them all, and it's a lot. And so she, every time she would stand up, she'd fix her posture and find that neutral position that we had taught her in clinic. And then she'd go throughout her day, and then she'd sit back down, then she'd stand back up and redo it again. And to the tune that she was probably doing it 50 to 100, if not more than that, times a day of re-educating her posture. Now, to her credit, she nailed this. She really never missed. That was just she's just kind of athlete she is. She's just on it, and she wanted to improve. She's highly motivated, like most of our athletes are, and that is, she just did the work. And we saw her on the end of a week, so like Thursday, Friday. I saw her again on that next Monday. So one visit, it's an evaluation, and all we did was teach her correct spinal posturing in standing. I saw her 3 days after, I believe it was three, actually it was 2 days, because we saw her Friday, and I saw her Monday. And I saw her basically 2 days after, and she walked in and her posture was dramatically better. Now, she might have been showing off because she was in the clinic, but the thing is the minute we put her in movements, she was able to maintain it. And the best part about that was she walked in on Monday and looked at me and goes, "Hey, I haven't had hip pain since Friday." And granted, she hadn't thrown, but she'd worked out on Saturday. She's kind of like a hike on Sunday. And then she was with us on Monday, but she's like, "I usually have hip pain just getting out of bed sometimes. I have had none of it since Friday." Now, just everybody knows, I didn't do anything on Friday, but teach her posture. That's it. We tested it. If anything, it should have been more sore after Friday because we tested it so extensively. And she had no pain the rest of the weekend. So we felt pretty confident that we were on the right thing. And so that basically what we did is we put her on Monday, we put her on an even more intensive protocol. So not only was she doing this every time she stood up, now she was now doing exercises to maintain pelvic stability and control daily. I think we did twice daily. It's an interesting regimen. We had her doing bird dogs, we had her doing side planks, we had her doing modified crunch, we call it curl up. If you look at Stuart McGill's stuff, this is called his big three. And we had her doing one other exercise that I added in for her. We had her doing, I call them phone booths because I don't know what else to call them. You're standing, and what you do is you put your hands across your chest, you pretend like your sternum's got a laser pointer on it pointing at a target on the wall, and then you rotate your pelvis underneath your rib cage. And the idea is that you don't go outside of a box, or a phone booth is what I call it. So I call it phone booths, right? So you don't come outside of that phone booth when you're rotating through your hips and at the thoracic spine, but your rib cage stays stable. And that basically taught her to move her spine and her rib cage, her spine and her pelvis together, but still create rotation. And we did those four. We did a interesting rep scheme on the big three, where you do six. You basically she did 6 sets holding for 10 seconds with only 1 second rest in between each of the 6 reps, but then she rested 20 seconds. Then she did 4 for 10 seconds, rest 20 seconds, 2 for 10 seconds. And she did that for each of those 3 exercises. That would be the bird dog, the curl up, and the side plank. And then we did just 10 repetitions from one side to the other side in regards to her phone booths. And that's what we had her do for the next week. Now, I also encouraged her that whatever her normal practice schedule was, I wanted her to continue to do it, just to make sure that she wasn't going out and trying to throw 200 pitches in 2 days when she normally wouldn't. And in her case, she wasn't pitching in a competitive environment at this point. She did have a pitching lesson, and I encouraged her to continue to do that. And she also was going to practice with her team. And in her club and high school team, she plays another position, so I encouraged her to do that as well. And she ended up pitching twice that week, once in the lesson and once at her practice. Actually, she pitched more than that. She pitched 3 times a week that week. And she came back to me again the following Monday, and I asked her how it went with pitching, and she said, "I still feel pain." And it was kind of sad because we were hoping for this dramatic improvement, no difference, no problem or anything like that. And she still had pain with pitching. But what she did tell me is that she didn't have any pain with hitting, and she almost always had pain with hitting. So we saw improvements. We were getting better. And so we kept her on the same regimen, but this time what we really encouraged her to do is we moved her hip from full range of motion. So we basically said, look, you got to maintain your pelvis, and you got to be able to show me full hip flexion and full hip extension. So raise your knee to your chest, and then take your foot as far behind you as you possibly can, but you don't lose any of your pelvic positioning. We did that. For those that are looking for these kind of things, this is If you search my YouTube channel, Athletic Potential, these are mentioned as hip CARS, CARS. It stands for something. We don't need to talk about it here. But if you look at it, that's what we had her do. And to be honest, it wasn't so much to improve her range of motion, which although that's what those things are really kind of built for, it was to teach her to maximize her range of motion in her hip without pelvic movement. So we had her do those. We also did some more traditional squat patterning and hinge patterning to start with that. And she went and did that for another week and maintained her same pitching schedule and had no pain in pitching the following week. Now, we maintained this program and we put her on a more intensive program. Again, non-competitive season, we're in off season, so we're not just trying to treat the hip, we're trying to treat the whole athlete. We put her on a massive protocol in regards to a 6-day-a-week strength training program that included power, plyometrics, and everything else that you can imagine, in addition to trying to improve her hip control. And I can tell you this, long story short, we're months into this program. Well, I guess we're weeks, but I'd still consider it almost 2 months into this program now, right? And she was able to pitch in a tournament, 2 games, 200 plus pitches, no pain in her hip. And I think we figured it out, which is fantastic. Now, I don't think we could have done any of this without the prerequisite hip strength that she already had done with a previous physical therapist. We had the benefit of a hip MRI indicating that maybe there's something wrong there, but really no conclusive testing there to back that up. And what we found is after extensive testing, she just needed better pelvic core control and to then incorporate that into her throwing motion, which to be honest was the hardest part. And so great news is that she's doing fantastic. She's actually throwing, her velocity is up, which it should be. She saw a little bit of strength improvement. Not so much a growth spurt, but definitely a strength improvement. So we're kind of hoping that we'd see some improvements in her velocity, and we already see that now, which is great. Her rise ball is better than it's ever been, she says. I haven't seen it personally, but I would take her word for it. And she's extremely excited. And she is not even halfway through her programming right now. I told her she still needs to maintain her off-season training program. She's seeing us basically once a month now. I had this question from somebody the other day, like, it's nice to know how many times you saw that person to kind of give us an idea. Total times I've seen this client, 8 as of now. And she is scheduled to keep coming back for another couple weeks or a couple months. So we'll probably see her 10. In regards to her hip treatment, I know there's some physical therapists that listen to this, and in regards to hip treatment, it took 3 hip treatments, essentially. And how I say hip treatments is basically pelvic and core motor control learning and training. It took 3 sessions before we noticed no pain with pitching. And so fantastic news for her. We're excited to see how she does, excited for her season. Her team looks really good, so they may be able to make a big dent in our in the softball league and maybe even win some championships here. So we're really excited for her. And yeah, that does it for our case today. Softball pitcher with some hip impingement that was able to be resolved with good pelvic and core stability and control, and integrating that back into her pitching motion. So, all right. So let's go ahead and transition now. We're going to transition to our questions from our audience. And let's jump right in. So our first question comes from Brian. And Brian says, how do you know where to start your youth athletes in regards to training? I feel like there are so many options and would appreciate your opinion on how to navigate all the noise, he says. This is a great question. And to be honest, Brian, this doesn't just apply to our youth clients. This applies to all of our clients. We have a general framework that we use here. I've talked about it previously in the podcast. I believe episode 1 really kind of laid this out. But let me just lay it out a little bit more succinctly here. Basically, my job when our training clients come in is to identify first and foremost the goal. What is it that you're trying to achieve as an athlete? And that is obviously very specific for each athlete. And that is important that it's that specific. So once we identify what they're really trying to achieve, and maybe what we can do is use an example. Okay, so we're still in softball training. Let's stick with the softballers. Okay, so we had a client come in, softball pitcher, not the same one we talked about earlier. No pain, no problems, just came in for training. And in her case, she needed to get faster. She basically said, look, I can hit fairly well. I can field fairly well. She is a middle infielder. But she says my lateral quickness and my speed my top end speed, my ability to run out a ball to first base, or to lay out a single or to do a double. I just need a faster first step and just overall better top speed. And I always say that that's not the goal, that's the description. And the goal is so that I can beat out throws or take a single and make it a double where I've only been able to make it a single. So that is the goal. She wants to be able to essentially improve her on-base percentage and batting average and all those type of things because she's faster, right? And she also talked about lateral quickness and speed in regards to being able to field her position. So those are her goals. So that was her point B. We always call it point B. Point B is where we want to see the athlete get to. Point B is, in her case, a little bit tough to measure, but the idea would be we want to see her be able to beat out throws in a game. Now, a lot of people are like, well, you can measure it. It's just how fast does she run down first baseline? And I'm like, it's not that simple. It's as simple as it's as complex as how do we know when a single should become a double? We don't know that. But what we want to see is on her stat sheet, she had more doubles than singles last year. Now, there's a lot of things that go into that. I get that. But if she's seeing more doubles than singles than she saw last year, I don't know if we really are going to care if it's the speed that did it or if she just hits the ball better. You know what I mean? Either way, if we add both together, she's going to see more base hits. She's going to see more success in regards to making maybe some extra base hits, or maybe she'll just have more singles too because she'll beat out the throws to first base. So anyways, that's kind of her goal. So we established that's the point B. And then the hardest part is determining point A. All right. And so point A is really up to me. A lot of people have a hard time understanding where they're at. Point A is where you're at now. And it's my job as a strength coach and the trainer to be able to go, okay, here's where you're at. And we need to measure appropriately according to the goal. So in our softball players example, we definitely measured top speed in regards to her 10 yard. We want to see how fast she could go in 10 yards. Essentially, we used 5 yards for her because softball's got a little bit shorter distances, but we measured 10 and a 30 yard. 30 yards a little long, but that's okay. And so we want to measure top end speed, and we want to measure first, essentially like 4 or 5 steps. And so we measured that speed. We used timing gates for that. And then not only did we do that, but we also measured her ability to run timed from home plate to second base. We didn't do third base, but we did second base because she had mentioned that. And so we kind of just looked at that overall time because, again, if we improve her technique, where she hits the bag, how she rounds the bag, how she makes turns, her balance as she does so, all of those things are going to just improve her time, right? And so we measured that as well. And then we did traditional strength measures and everything else that are really important to kind of that fill in the formula that allow us to improve quickness and speed. And then we build a program from there. The other thing that I didn't mention, Brian, is that there's a time frame for this, right? She came to us in an off season, and so we had months to prepare for this, essentially 12 weeks or 3 months. And so we had a decent amount of time to write programming and to test it appropriately. And so in regards to your question is, how do you know where to start in regards to your youth athletes? So let's talk about youth a little bit. So when we talk about youth, I think we always kind of come down to like the 12 to 13-year-olds or younger. How do we start there? How do you know where to start? What's their point B is just to play better baseball sometimes, right? That's kind of the best answers we get out of the 12-year-olds, right? Or I had a 12-year-old the other day say, look, I'm on the B team. I want to be on the A team. How do I do that? What can I do to get to there? Well, his point B, which is actually his A team, not to be confusing, is he wants to be able to play on the A team. And so where is he at now? Well, he's on the B team. And then we have to identify, well, what are the A players doing that the B players can't do? And in his case, there's a lot of skills work. He was a little bit raw. He needed to do more hitting and fielding to be able to be more consistent that way. And then in his case, we helped him a lot in the gym because we made him more coordinated, and that was our goal. And in his case, we use a lot of different things to test, but testing is another question. So how do you know where to start? We need to know the goal. If you don't know the goal, it doesn't matter which way you go. I think it's Alice in Wonderland, right? And Alice walks up to the Cheshire Cat, and she goes, there's look down both ends of the road. I think it's 2 different roads, right? And she looks at the cat and says, well, which way do I go? And he goes, well, it depends on where you want to go. And she goes, I don't know if it matters. He goes, I don't think it cares. Doesn't matter where you go then. You can pick either one. If you don't know what your goal is, you can do anything. You'll probably make progress towards something. And so I think the first key here is, Brian, know your goal, or have the athlete know their goal. Figure that part out. Once you've figured that part out, your point B, then you need to then find out your point A. Now, sometimes it's going to take a professional to figure that out. That's obviously what we do here at Athletic Potential. But sometimes you can kind of figure it out on your own. As a parent, if you're talking about for a youth athlete, then you can look at what the other teams are doing and how they perform and those type of things. Are they bigger? Are they stronger? You got to remember, in youth, you got to remember something else. In youth, there is an age factor here, obviously, but there's a maturity factor. So some youth A teams are just going to have the bigger kids on them, right? Because they've hit a growth spurt sooner than everybody else. So they've got longer limbs, they can swing a bat faster, they can throw a ball harder, because they have a little bit more mature skeletal structure. In that case, you just basically say, well, I can't control that, other than teaching my kid to move better and more effectively is about the only thing you can do. And if you're on the B team because you're your child, or you're the player, and you're just smaller than everybody else, don't take that as the wrong way. Just understand that there's substantial evidence out there suggesting that late bloomers actually seem to go a little bit further, than early bloomers. I think we all have that story of the kid that we faced when we were 12. I know I have mine. I can remember to this day facing that kid, and he was huge. He was scary. He threw the ball really hard. Luckily enough for my team, we were able to still compete with him. And in high school, he batted ninth in the lineup, and he barely got a shot. He just never grew after eighth grade. And all of us grew, and we just kind of excelled beyond him. So just understand that if you're not the biggest kid at that age, it's okay. You can still improve your athletic ability as much as possible. So, Brian, sorry, I kind of went off on a little bit of a tangent to answer your question. I think the first thing you need to know is what's the goal. The second thing you need to figure out is where that athlete is at that exact time, and then pick the top two things that will help them progress towards their goal. If you can't figure that on your own, it's absolutely helpful to hire a coach. Okay? Great question, Brian. Had a couple other things that kind of hit me in the head with that one. But to be honest, it's probably an entire another podcast that we can talk about. And if you would like to know those things, shoot me an email. I'll send them to you. Okay, let's go to question 2. This question comes from Jenna. Jenna says, I hear you talk about testing your training athletes, and I hear you always talk about testing your training athletes, and I'm wondering just how often you are testing them. And if so, what testing are you using? I feel that when I work with my athletes, it takes an entire training session to get through testing, and I'm not always sure that is the best use of their time. You nailed this, Jenna. Testing can become very time-consuming and laborious, and I don't think it needs to be. And training time, I always feel, needs to just be packed and be dense with the most effective training methods as possible, unless you're in training in an elite level sense, meaning hours per day, and they're coming back multiple times. So to answer your question a little bit, Jenna, I use basically one test or two tests depending on the athlete's group, age, and sport. And I do that as it's not even a formal test, to be honest. I just incorporate it into the programming. Best case analogy that I use, softball training group that we're running right now, they do a double leg standing broad jump once a week. Okay, and it's super easy to test. And when I say test, they literally are doing a set of 5 as a part of one of their circuits. And what I do is I kind of walk over to that as a coach. The other exercises, a part of that circuit, are ones that they've done, they're fairly good at, and I don't have to coach them a lot. And so what I do is I just hang out at the broad jump area, and I kind of watch the girls jump. And I have an idea mainly because I've looked at it, right? And I kind of have an idea where I'm at because I've kind of measured it out. Maybe I did a little bit of pre-work before they came in, and I kind of know what distances. They always kind of start in the same line. The line is literally a line in our flooring mats. It just lines up across it's just where the two mats come together. They always line up there, and they all jump in the same direction. I know how big the mats are, and I have an idea of how much each girl has already jumped. And so what we do is we just have them start there, and they do their broad jumps in that station. And I watch them, and I get a basic idea without like written down measurement testing, even though we are doing that a little bit more effectively now. I just look at it and I go, yeah, that's better. Or I'm not sure that's much better. Or yeah, we're not jumping very far, and maybe that's because of programming error, or maybe we've just got a bad program and we're seeing a reduction in our ability to broad jump. And broad jump is one example. You could use a bunch of different testing here, right? We use grip endurance testing. Hangs are a great way for this. Mobility wise, we use hangs with our athletes, and it's just always a part of their circuit. And I can stand and I can watch them do it, and I can kind of time it, right? And I go, okay, well, everybody kind of, we don't do max hangs here. What we do is different types of hangs. I don't know if that long endurance hang is really showing or telling us much, but it's a nice way to test somebody when you give them a fat grip and have them to try and do that. And the idea is anything over 30 seconds I consider to be fine. We don't need to worry about it. And but I try to give them a hang that doesn't allow them to hang for that long, because then I can see how well they do, and that's a nice little way to test it. So Jenna, I don't know if this is what you're asking for. If you want quantifiable data, you want numbers, you want to be able to be like, this is better because that number is bigger than that number, or smaller or shorter, right? Or shorter time frame. Timing gates, if you're working sprinting, are super easy to set up. I recommend 10 yards. You do a 10-yard dash as a part of their sprint work, right? Each girl hits the gates at least once. So it's a part, so everybody's sprinting, but if you have 20 girls, you're going to do anywhere from 10 sprints each, and every girl has to get the time gates once and gives you a test, right? And that's not terribly difficult. You just need to prep it and have whatever device you're using to measure, and have somebody writing it down. And that's a pretty easy thing to do. By the way, you can have the girls or the training athletes write down the numbers for you, as long as you trust them. Which, and to be honest, most of our athletes are pretty good at that. Just because they all understand that it's not about true numbers, it's about their number, right? They're not competing with each other, they're competing with themselves at that point. So that'd be another way to look at it. Just one test, easy setup, almost no coaching, and all you have to do is observe. I think this is the way we test our athletes here at Athletic Potential. I use the broad jump a ton. We use timing gates in regards to speed. We use med ball throws quite a bit. So I'll actually have them stand back at a certain distance and throw a med ball and see if they can reach the distance. It's part of their exercise programming. And so if they can't, then they're still not, they demonstrate they need to improve their power, their rotational power. So that would be another one that we use. We don't max out on testing in regards to strength as much. I'm a big fan of 3 to 2 reps. Single maxes are good, but I feel like we get more out of other rep schemes. And let's be honest, you do enough lifting, you're going to see weights increase. They're a little bit easier, right? Because they're already numbered. And if we're starting with 40 pounds and now they're lifting 65, they're stronger, right? And so that's an easy test. So Jenna, I hope this answers your question. Keep it simple. Only test what you're going to retest. So a lot of times we throw in these big tests and they look cool and they're extravagant and everything like that. To be honest, I was taught if you're going to test something, it's only because you're going to retest it. And so if it's a major chore to do it, then you need to really think, okay, this is going to take a lot to retest this. So case in point, we tested an entire baseball and softball team, collegiate team. It took hours for each team to get it done. We are going to test again. We've already scheduled it. It's at the beginning of the spring season of when we're going to test again. And so we know we're going to test again. It's the only reason we did it is because we knew we were going to test all the same things again. So In regards to training clients, I don't do those big elaborate tests. I do simple tests that I can kind of keep coming back to make sure that they improve. And just remember, each athlete should have a individual test based on their individual goal, which is the hardest part for us. Something that we've kind of really struggled to figure out. How do we individualize our group athletic training, or our group training for each kid or for each athlete? That becomes very challenging, and we're still figuring it out, to be honest. We're still figuring it out. So, Jen, I hope that answers your question. So, all right. Well, that does it for episode 27. We appreciate everybody that tunes into the podcast. We appreciate all the questions. It's always fun to answer them. We definitely get a lot more questions in regards to just on a normal daily basis. But if you do have questions, again, just listen to how to do that here at the outro, and just understand that we really appreciate all the time and that you put into listening to this podcast. If there's ways that we can improve it, please let us know. Yeah, we appreciate it, and we'll catch you next time. Thanks.